Good morning, Commissioner.
Good morning.
Good morning, Bridget. Good morning, all. We'll go ahead and get started. Thank you all for joining this morning. Got some fairly good news today from Greg Kesterman, which is something I don't often say. So we're going to get to Greg fairly quickly here. I will run through the numbers. So in Hamilton County, the number of positive cases total is up to 176,086. The number of hospitalizations is at 5,311. And we have lost 1,767 people in Hamilton County to COVID-19 since the start of the pandemic. So for those of you that are kind of keeping track of these numbers, that number for positive cases is quite a bit lower than it was last week. So it's still a very high number. The Delta is right around 8,000, which is a very high number. But it is lower than what we've seen in the last couple of weeks, and I'm going to let Greg elaborate on that. The number of hospitalizations is still very high, and we've been hearing this from every hospital system. I was on a call yesterday with a number of hospital systems and the mayor and the health collaborative talking about the constant strain on their facilities, on their staff, and so they are still under duress. And so I don't want to sugarcoat any of those numbers because we're still at a very high level in the hospitals. And that has not really started to trend down at this point. And it is a lagging indicator, but it's still an area of concern. And then the deaths, the Delta or the change from last week, the increase is 53, which is a significant number when we're talking about lives lost here in Hamilton County. So while we do have some positive news related to positive cases, the other two numbers are no reason to celebrate, just to kind of put the wet blanket on it. So with that, I am going to turn it over to Hamilton County Health Commissioner Greg Kesterman for his slide presentation.
Well, good morning, and thank you, Commissioner, for the introduction. This morning, as Commissioner Driehaus indicated, we are seeing some relief with regards to cases. For the first time in over a month, the number of active cases in Hamilton County is less than it was a week ago, which is a great indicator. Today, we have about 36,000 active cases of COVID-19. A week ago, we were at about 40,000 active cases of COVID-19. Maybe a better way to visualize this is we had a peak on January 16th. We had 2,470 cases per day. And as of yesterday, our case average was at 1,129 cases per day. That is nearly half, which is great news. We are seeing a rapid decline. We did receive word late yesterday afternoon that there was a one-day delay in reporting per the Ohio Department of Health's data laboratory. And so some of those numbers might get adjusted, but it will not catch back up to the peak in any way, shape, or form. We are definitely seeing a decline in cases. Now, I do want to put this in perspective. Let me first constantly remind people, keep sick at home. Sorry, I forgot. To put this into perspective, though, as Commissioner Driehaus alluded, we have seen a significant decline in cases. However, we have so much COVID-19 within our community. Every single jurisdiction in Hamilton County is impacted by COVID-19. There remains a lot of activity. And so while some of the news that I share does offer some hope, I am really encouraging people to continue to be as cautious as possible. Our hospital systems, while we are seeing some shifting and potentially some decline in the numbers of people within our systems, we still have more people in the hospital today than we've had really at any other peak within this pandemic. So really want to encourage people to work hard as a community in the coming weeks. Because we have seen such a dramatic drop in our cases, our reproductive value is at a pandemic low. We are at 0.61. For the region, we're a little bit higher. We are at 0.81, but both are trending in the correct direction. Our percent positivity for the region is at 31.4%. And folks are still, as you can tell from the bottom of this graph, folks are still going out and getting tested, which is excellent. So if you feel sick, we'd like you to get one of those PCR tests to confirm if you have COVID or not. But ultimately, really the message is keep sick at home. So I mentioned the hospitalizations. This morning, we are at 995 confirmed individuals within our hospital systems with COVID-19, 186 in the ICU, and 126 on ventilators. In the top two boxes, you can kind of see some flattening of those trend lines and maybe even a little bit of a decrease, which is great news. We're not continuing to see that upward slope that we had seen all throughout the last month. So that is definitely promising. I can tell you, though, that when I talk to the folks within our hospital systems, they are continuously reminding me how overwhelmed their staff are, how busy the system is, and how important it is that people not forget the messaging of keeping sick at home, washing your hands, covering your cough, wearing a face mask when in public settings. So I just really want to continue to ring that point home so that everyone does our part to help our hospitals recover from this pandemic. As Commissioner Driehaus said, we have seen an increase in deaths over the last week. We are continuing to see 4 to 5 deaths per day, although as you notice from the graph, there are certainly days that have seen more than 5 deaths. So the pandemic is certainly having an impact on our community. Turning to the Centers for Disease Control level of local community transmission map, Hamilton County remains high incidence for COVID-19, as well as the entire state of Ohio. This morning, we are at 1,118 cases per 100,000. This number has continued to drop day after day, which is excellent. Our percent positivity this morning for Hamilton County is 14.25. So just a moment ago, I mentioned for the region, we are over 30%. Hamilton County is half that. So that is great news as well. That's another indicator that things are heading in the right direction for our county. Turning to vaccinations, we continue to see a large portion of our population already vaccinated. At our clinics, we're seeing a lot of folks coming in getting those booster shots, as well as individuals in the age range of 5 and up. So we are excited to continue to provide these vaccines. I know that we have lots of opportunity at our Board of Elections site for vaccinations. There is no requirement to register online. You just come on in and we'll take care of you. We have availability today and every day this week. So feel free to stop by and visit our website as well for additional clinic information. And the last slide that I have this morning really is just a reminder that testandprotectcincy.com does have opportunities throughout Hamilton County to get vaccinated, to get your tests if you want a PCR test or if you want a different type of antigen test. That is all available on testandprotectcincy.com, and it's up to date and a really great resource for our community to find access to the necessary testing and vaccinations. With that, I will turn it back over to you, Commissioner.
All right, very good. Thank you, Greg. Appreciate that update. All right, Bridget, why don't we go to questions?
Okay, first up, we have Morella Porter from Local 12. Morella, we just promoted you to a panelist, so feel free to turn on your video and audio.
Okay, thank you so much
morning.
for joining us this morning. So a question that's halfway related to this. So I know we're talking a lot about, COVID, the transmission, staying home if you're sick, and then also social distancing obviously is still important right now, right? So obviously we've got a really big weekend coming up with the AFC Championship, the Bengals heading to Kansas City. I know there's been talk amongst other commissioners, county commissioners, health commissioners, about gathering at Paul Brown Stadium. This is a question really for Commissioner Driehaus. Do you have any stance on that right now?
Well, we heard about this yesterday. So yeah, one of my colleagues, Commissioner Reese, had this idea, and I think actually it bubbled up from somebody in the community that said, hey, why don't we have a watch party at Paul Brown? And so I know she has asked the administration to look into that. Let me just start by saying, who's not excited about the Bengals game? I mean, I think we're all pretty pumped about the Bengals game, looking forward to winning this one and going to the Super Bowl. I mean, the level of excitement in this community is off the chain. And I too am very excited, and I'll be wearing my Bengals gear tomorrow for the meeting because we're all going to have our orange and black on. I've got my ball cap I'll put on. So anyway, we're super excited, super pumped, and the whole community is celebrating the success of the Bengals right now. So I join in that. So this idea related to having a watch party at Paul Brown Stadium is one that I know the administration is looking into, looking into the logistics of that. Can we provide enough safety? What about the vendors? Who is going to run the score? All these things need to be taken into consideration. And I think the timing is challenging here because it is such a short time frame. And never mind, we need to get the Bengals, who are partners, obviously, in this, get them on board. The NFL, my understanding is, has to approve of it. So there's all kinds of stuff going on related to whether or not that can happen, and whether or not it should happen too. And so I also want to say that so we may or may, I mean, I don't have a definitive answer related to Sunday. I would advise you to contact Commissioner Reese's office. She may have more up-to-date information. But that said, I think, it's something we could contemplate perhaps when we go to the Super Bowl in the middle of February. But in the meantime, we've got all these celebrations happening, watch parties happening throughout the community at some of the small businesses, especially those on the banks. And so, the Holy Grail and the Taste of Belgium and the Moraline House are all down there, and the Dora District's open. And so there's a lot of energy, and there will be plenty of opportunity to celebrate down on the banks. My understanding is that the Reds are going to have they've got this video screen outside of that stadium, and it'll be projecting down into the Dora. So that'll be on. So lots and lots of opportunities to celebrate for the community. Yeah. And we've been talking about this actually a little bit at these briefings related to safety and keeping everyone safe. And so I'll leave it to the health commissioner to expound on it, but he has been saying that outdoor venues are better than indoor venues. But if you're going to be in close proximity with other people, throw the mask on. Don't go if you're sick, obviously, stay home if you're sick. But if you're in close proximity with people, throw the mask on. And if you're having a drink during the game or eating a chicken wing during the game, lower the mask, do that, and throw the mask back on. So, Greg, I don't want to misstate that, but I know that's what you've been saying for the last couple of weeks.
Yeah, that's perfect. I'm really encouraging folks to be cautious. Things are heading in the right direction. We don't want to slip backwards as we celebrate the Bengals. We want to make sure that people are safe. And, the most important thing, I can't say this enough, if you wake up and you're heading to a party and you got that sore throat or you got a little cough that you didn't have the day before, it's possible that's COVID. And so I'm just asking folks, use common sense, keep sick at home. Don't make your friends sick too. Keep your family healthy. Those are the best ways that we can celebrate this weekend.
Perfect. Thank you guys so much. I appreciate it.
Thank you.
Next up, we have Chris Wederick with the Business Courier.
Hey, good morning, everybody.
Morning.
One for Greg, one for Denise. Greg, speaking of the Bengals, did we get much of an indication as to whether there was much transmission at the playoff game a couple of weeks ago?
Our cases have been kind of through the roof over the last several weeks. We did not see any individual spike that we could associate with the Bengals, although what we did see was highest case numbers in the pandemic. So I'm not certain that I could attribute that to the game or to the gatherings that might have happened, but certainly to the overwhelming presence of Omicron in our community over the last few weeks.
And then, well, this might be both for both of you. I'm curious how you think we should frame this today. Have we reached the peak, or are we hoping that we've kind of reached the peak with, the lagging indicators continuing to be high?
My personal belief, how we should frame it, is that I'm very optimistic that we've reached the peak, but until we have a little bit more data, it's really hard to say. But many things are trending in the right direction, and I'm very optimistic that in the coming weeks, we'll see drastic drops in our hospitalizations, but we're not there yet. So we got to be a little careful.
All right. That's all I had.
Yeah, thanks, Chris. I do want to just layer on, it is a bit of a mixed message because the cases are going down, but the hospitalizations are still very, very high. So still, a cautionary note related to this, even though we are starting to trend in the right direction.
Great. Thank you very much.
Next up, we have Mariel Carbone from WCPO.
Good morning, Mariel.
Oh, yes. Well, so Chris kind of asked us similar to what I was going to ask, because, we keep hearing so much about, could this be the endemic? And then we're hearing, all right, COVID cases are coming down. That's great. But you still look at the numbers, 14% positivity rate. I think back to when this first started in the summer, and it was, or 2 summers ago, and, we're hearing 10% was when they were telling you don't travel to other states.
Mm-hmm.
So, I mean, are we in a good place? Could we actually be nearing the end of all of this, or is that just not the case?
We have been watching what is happening around the country and particularly in Ohio over the last several weeks and working with our data partners at Cincinnati Children's Hospital and the Health Collaborative. And the data suggests that we are very closely following what happened in Cuyahoga and is now happening in the Columbus, Franklin County areas, in which they saw an extremely dramatic drop in both cases as well as hospitalizations. It looked like maybe we were a couple weeks behind them. And so if that's the case, then we are very optimistic that this case decline that we're seeing right now is attributed, just like we saw in Columbus and Franklin County, to the drop in cases, and we will see relief for our hospital systems.
Marielle, may I just say that the optimism is about the trend, not so much the number, because the number is very high. As you point out, these numbers are still very high. It's the trend going down that gives us some optimism.
Thank you. That's it for me.
Thanks.
Next up, we see Todd Dykes from WLWT.
Hello,
News
Todd.
Five.
Hi, everyone. Good morning. I was
Good morning.
a couple minutes late to the meeting, so if I'm repetitive, I apologize. And it's probably to you, Greg, first, and then Denise, however y'all want to handle this. Have there been conversations at the county level about what, again, we're talking hopefully the end or the big transition or whatever? I'm reading a lot and seeing a lot of coverage about just the psychology involved of the off-ramp and how do people think about maybe not wearing a mask at some point. I know we're not there, but are those messaging matters and talking to people so we all don't continue to live in a bubble forever if we don't need to, but if we need to, we need to. What are your thoughts? And I have a follow-up after that real quick.
Sure. Would you like me to start, Commissioner?
Please,
Sure.
yeah.
So at a high level, we are very excited to have the relief that we think we're going to get in the next few weeks from Omicron. That said, from a public health perspective, we are putting a lot of time and effort into planning and making sure we're ready if we see a new variant in the future and making sure we have the steps in place. So we're not letting our guard down at this moment. The really good news, though, when you think about this outbreak or this pandemic as a community, we are getting much closer to a point where we have other options to help make people healthy when they get sick. So if somebody gets the flu, they run to their doctor and they get prescribed Tamiflu. Up until recently, we have not had those types of options for COVID-19. We now have some antivirals that are on the market, although they're in extreme short supply. But if we have a few months to catch up and to start building some supply, we will have new options for keeping people out of the hospital and developing serious COVID-19. So long term, I think there are going to be some great reliefs for the population of Ohio and Hamilton County. We'll have the necessary medicines to help make people healthier. We'll still have to work together as a community, but hopefully it won't look quite the same in 6 months, 9 months from now.
Good stuff. And this may be to you, Denise, because I was actually going to ask about Paxlovid and the supply, because Dr. Vanderhoff last week said we hope the pipeline opens soon. And it sounds like, we can talk about that if you'd like, because there are a lot of doctors that reach out to us in the media and say, talk to these health leaders. When are we going to get more of these medicines and these monoclonals and all that? But I am also struck by, and Denise, this is an equity question. I was reading this morning that the free N95 masks, they're starting to become available at pharmacies and Kroger and Meijer, and you can get 3 per person, whatever. But that the White House is saying that they'll be in community centers and places where people are a bit more marginalized, perhaps, like in March and through May. That's a whole month. And that seems kind of wild to me. I mean, this is just what I'm reading. I don't know if I know we're all dealing with this in real time, but with regard to masks, if somebody who lives in a socioeconomically challenged area would like to take advantage of these masks, but there's not a Kroger nearby or whatever, what can the county do to facilitate that in a more equitable way?
Well, we've been worried about equity throughout this whole pandemic, and Greg has been a great partner in this space. But we have literally contracted Closing the Health Gap to make sure that we are paying attention to equity and disparities, really is what you're pointing out, in the community when it comes to healthcare and other disparities when it comes to access, whether it's the lack of a computer or the place where you live, or, it varies from place to place, but we're very cognizant of this, which is part of the reason Greg did this and the county did this. We had mobile units moving around this community to make sure that if people didn't have access to transportation, perhaps to get to a site where we were doing vaccine clinics, we took it out with the 513 relief bus, with the 3 mobile units that public health had. And so that model is our response to trying to make sure that everyone has access to what we have to offer. So, and remember that we've got testing coming online again here at the county. We did $14 million worth of testing in the last couple of years and made sure that it was available to everyone. And also at some of the health clinics that are in some of these areas that have health disparities. But anyways, but Greg, you've recently talked to me about the mobile units that you have and where they're going. But Todd, even with the PPE from the very beginning, EMA through Nick Crosley has been dispensing this for free, because what the county did was invest in a stockpile of masks, gowns, gloves, sanitizer, the things that people were asking for. And when a school or a nonprofit or any hospital reaches out and says, we need, masks, out they go. And we have not hesitated to do that. And so we've always been trying to fill this gap and move in this space to make sure that we are paying attention to equity in Hamilton County. So Greg, would you please expound on the mobile units that you have?
Yeah, so throughout the pandemic, we've had the mobile units that Commissioner Dreehouse just indicated, and we've really focused on areas with high social vulnerability indexes, so low-income areas in Hamilton County. During the big peak of activity for folks trying to get vaccinated before the end of the year, we had a Board of Elections site where we focused a lot of attention, and we still had 1 mobile unit pretty much every day running out to the community. As some of our numbers at our Board of Elections site are dropping, we are continuing to push that 1 mobile unit out and actually starting to shift towards 2 units throughout the county. That's in addition to a homebound team that we have, that if somebody is stuck at home and can't get out to get vaccinated, we actually come straight to your home and are providing vaccine. So we're really trying to do our best to get out there. And to the point of the masks, I've not really explored this as an option, but it's possible that we might be able to get a supply on some of our mobile units and take it straight to the communities where there is a need.
Thank you both.
Thank you.
Next up, we have Brooks Sutherland with the Inquirer.
Good morning.
Hey, good morning, folks. You talked about this at the top, but I just want to follow up. Commissioner Kesterman, there's a lot of evidence, right, that outdoor is much safer than indoor, and regardless of, even if there's a lot of people there. Would you actually recommend, if we have this watch party at Paul Brown, that people do that instead of packing in bars?
I think we're going to see a little bit of everything regardless of what I recommend. Folks are excited about the Bengals and are taking advantage. But if you are able to be outside, I would strongly recommend it. We know that Omicron and COVID-19 in general are spreading less in the outdoor environments. And so whether that's at the Dora District or many bars have created patios and tables outside for their guests, if the weather is tolerable, I would recommend you try and enjoy the game outside as much as possible.
And you gave guidance on wearing masks in a gathering like that at Paul Brown. Is there anything else? I mean, would it be to avoid as many meetings and gatherings in the concourse, stay in your seat? Do you have any other guidance if we end up having that gathering?
We did a little before the last playoff game. We did a little social media imagery, just encouraging folks to mask and sip. I would certainly encourage folks to continue that mindset. Wear your mask when you're not eating and drinking. In addition, I can't say this enough, and I've said this probably 5 times already today. If you wake up sick, stay home. If you're sick, you are the reason why things are spreading. And we just wanted to stay home and not go out into the community. So I'm really asking each person to do their own individual, take some own responsibility and make sure that they're not making their friends sick on the playoff game this Saturday.
Thanks, commissioners.
Thanks, Brooks.
That seems to conclude our questions from reporters.
Okay, great. Thanks again to Greg. I do want to, Houday, I want to do a reminder about what's happening on Friday to the point of having a big pep rally outside. So there's a huge pep rally outside on Friday at the Banks. It's from 4 to 7 on Freedom Way. It's going to be free to the public. There will be mascots, bands. Icky Woods will be there. Anthony Munoz, Fulcher will be there. So we've got a lot of celebrities that will be down on the banks. Evidently, the beer and soda sales are going to Special Olympics. So that's a nice bonus. So anyway, I think we're all looking for a way to celebrate safely, and let's celebrate this huge moment in time for Cincinnati and the Cincinnati Bengals. We're super pumped. So there's a big rally, and then of course the game on Sunday. More to come after we win the game related to the Super Bowl. So stay tuned. We'll be back next week. Thank you.
Thanks.